So you obviously work with a lot of, athletes, young and old, across a broad spectrum of everything.
Yep.
And you've seen, injury after injury and injury, and injuries are going to happen, right? We're going to get injured in every single sport. Okay. Mm-hmm. But if you had kids and you wanted to guide them to a particular sport that you thought would be the best long-term for them. Obviously, football has got the concussions. They've got some serious issues there, Which would you consider to be kind of the quote-unquote safest sport, I guess, for long-term prevention of those long-term injuries? And which one would you consider to be maybe the most quote-unquote dangerous, I guess?
Yeah, that's tough. When you're looking at injury risk, as researchers, what we do is we look at these long-term systematic reviews of epidemiological studies is the scientific way of saying we're looking at things long term. And when you look at different sports, there's different injury risk levels. So like soccer or, European football is going to have a specific type of injury risk. I know people are watching this over in Europe, You're going to have a certain injury risk level, like so much percentage of people have this type of injury. And then you break it down as to, is it a serious injury? Is it an acute injury that only takes you out for a day or so? When you look at your sports, your traditional field sports or court sports, basketball, baseball, football, soccer, they're going to have usually higher risk of injury, especially your soccer and football, than CrossFit or weightlifting, per the studies that we see.
That's interesting about soccer, though, because I wouldn't think that would be kind of one of the higher injury ones.
And that's the thing is soccer it has a high risk of injury of usually things like sprained ankles. Like that's what's brought into it. Sprained ankles, a torn ACL is actually a higher risk in soccer than it would be like for baseball.
Just so much cutting, yeah.
Exactly, that's the big thing. So usually they're not going to be like, injuries that really take you out for season-ending things. There's going to be higher risk of, I think, more serious injuries in football because of the contact. But the thing with the research that we've seen with sports like weightlifting and powerlifting, and then CrossFit, we're bringing that into obviously having a lot more research recently, is the risk of injury isn't as high because of a few things. We are doing controlled movements with great technique. So you have to have a good coach. That's the big thing. When you have a good coach, they're able to set standards for what that technique should look like. You're going to have programming as far as allowing you to manipulate the variables of intensity and volume and, what you're trying to do. And that's going to decrease your risk of injury. Now, you take that same person and throw them into weightlifting, powerlifting, CrossFit, and have a horrible coach that doesn't care about technique or a program that's not right for those athletes. Sure, injury risk could be as high just as well. I think the big thing isn't necessarily to look for which sport is better than the other, because that's going to be a personal preference. Sure. But it's the big thing is how you're approaching that sport and how you're interacting with it and taking care of the injuries that do arise.
Well, you talk about, training is when you're 24, 25, as opposed to, when you're in your 40s. If you're trying to do the same thing at that particular moment, it doesn't really matter what sport you're in.
Yeah.
You're going to have to adapt that in order to, prevent overload on your systems.
I mean, the big thing is how you train your body to handle the forces that are coming with that sport. I mean, you look at like Kobe Bryant. I mean, he was in the NBA for how long? He also took very good care of his body and trained it throughout the years. And you see a lot of these athletes that get into other sports. I mean, we can even take it in strength sports as well, that do things more than just the traditional aspects of going with the sport. If you're a basketball player, you're not just playing basketball. If you're a football player, you're not just playing football. If you're a CrossFitter or a weightlifter or a powerlifter, you're not just doing the traditional lifts, but you're doing the things on the side that are going to help you maintain the quality of your body for long term. So you're doing the proper corrective exercises. Recovery is key. Making sure that you're able to listen to your body and respond to things so that you can handle and adapt to the demands of your sport.